Do you truly understand the difference between a heart attack, a sudden cardiac arrest, and long-term heart failure? Don't be so sure. Most people just nod along, treating them as distant medical jargon, until the sound of an ambulance siren cuts through the silence, until a loved one suddenly collapses, or when your own breath grows alarmingly heavy. This dangerous confusion isn't just a matter of terminology. It can mean missing life or death warning signs, delaying the golden minutes that could save someone's life. It's time we face it and equip ourselves with knowledge before too late becomes a reality. In the complex world of medicine, cardiovascular terms can often be confusing. Heart attack, cardiac arrest, and heart failure are three familiar names often used interchangeably. But understanding the distinct nature of each condition not only empowers you with knowledge, it can be the key to recognizing danger early and responding effectively, protecting your own heart health and that of your loved ones. A. Heart attack, a blood flow blockage incident. Imagine the heart as a house that needs a constant supply of fuel, oxygen-rich blood, delivered through a system of pipes, the coronary arteries. A heart attack occurs when one of these pipes becomes suddenly blocked. The main culprit is often a blood clot that forms at the site of a ruptured atherosclerotic plaque, a buildup of cholesterol and fats inside the artery. When the blood flow is cut off, the part of the heart muscle beyond the blockage is starved of oxygen and nutrients and begins to suffer damage and die unless blood flow is quickly restored. Key warning signs: chest pain or severe discomfort in the center of the chest, often described as pressure, squeezing, or burning. This pain may radiate to the arm, usually the left, shoulder, back, neck, jaw, or even the upper abdomen. Other symptoms may include shortness of breath, cold sweat, nausea, vomiting, or dizziness. Importantly, during a heart attack, the heart usually continues beating and the patient often remains conscious, at least in the early stages. B. Cardiac arrest, a total electronic system failure. Unlike the plumbing issue of a heart attack, cardiac arrest is a critical electrical failure. The heart has a sophisticated electrical system that generates rhythm and coordinates pumping. Cardiac arrest happens when this system malfunctions severely, causing the heart to suddenly stop beating effectively. The most common cause is ventricular fibrillation, a deadly rhythm disorder where the heart's main pumping chambers, the ventricles, quiver chaotically instead of contracting forcefully to push blood out. As a result, blood stops flowing to the brain and other vital organs. Emergency signs: the person suddenly collapses and loses consciousness. They will not respond, will stop breathing or gasp ineffectively, and no pulse can be felt. This is a top-level medical emergency. Every minute counts. C. Heart failure, the engine that's losing power. Heart failure does not mean the heart has completely stopped. Rather, it's a chronic condition in which the heart becomes weakened and can no longer pump enough blood to meet the body's oxygen and nutritional needs. It's like an engine that is gradually losing efficiency. Heart failure is often the result of long-term damage from other heart conditions, such as coronary artery disease, including past heart attacks, uncontrolled high blood pressure, heart valve disease, or cardiomyopathy. Common symptoms: shortness of breath, especially during physical activity or while lying down, requiring extra pillows to sleep, persistent fatigue and weakness, swelling in the legs, ankles, feet, or abdomen due to fluid buildup, a chronic dry cough, especially at night. The heart still beats, but its pumping ability is significantly reduced. Clearly distinguishing these three conditions is the first step to understanding cardiovascular health, leading to appropriate attitudes and timely actions. Part 2. Time is life. Recognizing emergencies and taking immediate action. When the heart suffers a critical event, every passing second can mean the difference between life and death. Recognizing the emergency accurately and initiating first aid promptly while waiting for professional help can dramatically improve survival chances and recovery outcomes. Never underestimate the power of swift, decisive action. A. Red alert. When must you act immediately? Cardiac arrest. This is a tightrope over the abyss scenario. The unmistakable signs: sudden collapse, loss of consciousness, no response to shaking or shouting, no breathing or acute heart failure decompensation. For those with a known history of heart failure, the condition can suddenly worsen. Danger signs include a sharp increase in shortness of breath, so severe that the person must sit up to breathe. Pink, frothy sputum, a sign of pulmonary edema. A very rapid or irregular heartbeat, and extreme exhaustion. B. The golden hour, a race against death. Always call emergency services, 911 or your local number, immediately when you suspect any of the above situations. This is the most important step and must be done first. In the case of cardiac arrest, a victim's chance of survival drops by 7 to 10% with every minute that passes without CPR, cardiopulmonary resuscitation, and defibrillation, if needed, via an AED. The brain begins to suffer irreversible damage after only about 4 to 6 minutes without oxygen. The golden time here is as soon as possible. In the case of heart attack, the top priority is to restore blood flow through the blocked coronary artery as quickly as possible to save the heart muscle at risk. Doctors often refer to the golden window as the first 60-90 minutes from the onset of symptoms for effective intervention. The sooner you get to the hospital, the more heart muscle can be saved. C. First aid can save lives. After calling emergency services, if cardiac arrest is suspected, check responsiveness. If the victim is unresponsive, begin CPR immediately. Push hard and fast, about 100 to 120 compressions per minute, around 2 to 2.5 inches deep in the center of the chest. If an automated external defibrillator, AED, is nearby, use it right away, following the device's voice prompts. If heart attack is suspected and the person is still conscious, keep the person calm and help them sit or lie in the most comfortable position, usually semi-reclined. Loosen tight clothing. If prescribed by a doctor, give nitroglycerin under the tongue or aspirin, as medically directed. Closely monitor the person's condition while waiting for emergency responders. Many heartbreaking stories have resulted from delays in getting medical help. Don't let fear, complacency, or lack of information stop you from taking action. Every minute is incredibly valuable. Part 3. Prevention is key. Building a heart-healthy lifestyle. While knowing how to respond to cardiovascular emergencies is essential, an even greater truth is this: most heart conditions, including heart attacks, can be prevented or significantly delayed through smart lifestyle choices. Your heart is a miraculous organ, working tirelessly to keep you alive. How you treat it every day determines its health and longevity. Don't wait until warning signs appear to start caring. Begin now to build a strong fortress to protect your heart health. A. Identifying the invisible enemies, key risk factors to control. To win the fight for your heart, you must first recognize the controllable risk factors. Smoking. This is enemy number 1. Quit now. High blood pressure, hypertension, often symptomless but silently damaging. Monitor regularly and treat if needed. High cholesterol. Elevated LDL, bad cholesterol, increases the risk of artery plaque buildup. Diabetes. Prolonged high blood sugar damages blood vessels. Overweight and obesity, especially abdominal obesity, which burdens the heart. Sedentary lifestyle. Sitting too much weakens the cardiovascular system. Unhealthy diet. Excessive salt, sugar, saturated fats, and trans fats are harmful. Chronic stress negatively affects blood pressure and heart rhythm. Sleep disorders, especially sleep apnea, which causes chronic oxygen deprivation. B. The golden formula for a healthy heart: habits worth building. The good news is that most of the above risk factors can be controlled by adopting healthy habits. This is the most effective way to prevent heart attack. Smart heart-friendly nutrition. Prioritize leafy greens, fresh fruits, whole grains, legumes. Choose lean proteins. Fish, especially fatty fish rich in omega-3, like salmon, tuna, herring. Skinless poultry. Embrace healthy fats. Extra virgin olive oil, avocados, nuts, almonds, walnuts. Minimize salt, under 5 grams per day, about 1 teaspoon, refined sugars and sugary drinks, processed foods, fast food, saturated fats in fatty red meat, butter. Regular physical activity, the heart's natural medicine. Target at least 150 minutes of moderate intensity activity, e.g. brisk walking, cycling, or 75 minutes of vigorous activity, e.g. running, swimming, sports, per week. Include muscle strengthening exercises, light weights, yoga, Pilates, at least 2 times per week. Find joy. Choose activities you genuinely enjoy to help turn them into lasting habits. Say no to tobacco and limit alcohol. Quitting smoking is the smartest decision for your heart. If you drink alcohol, keep it in moderation. Maintain a healthy weight. Keep your body mass index, BMI, between 18.5 and 24.9 and monitor your waistline. Manage stress and get enough sleep. Use relaxation techniques, meditation, deep breathing, music, and aim for 7 to 9 hours of sleep each night. If you suspect sleep apnea, loud snoring, daytime fatigue, seek medical advice and treatment. Get regular health checkups. Don't wait for symptoms to appear. Proactively monitor your blood pressure, cholesterol, and blood sugar, especially if you have risk factors or a family history of early heart disease. Follow your doctor's treatment plan strictly if already diagnosed with a related condition. Building a healthy lifestyle isn't a sacrifice. It's a smart investment in your future well-being. Start today with small but sustainable changes. Part 4. Living with heart disease and the power of empathy. Facing heart disease, whether it's a looming risk, a confirmed diagnosis, or the aftermath of a major event like a heart attack or cardiac arrest, is not just a physical battle. It is also an emotionally demanding journey filled with constant worry, fear, and an unspoken yearning to be understood. On this journey, empathy and support from family, friends, and the community play a vital role, helping patients find the strength to push through difficulties and maintain their quality of life. A complex emotional journey, unspoken struggles. People living under the shadow of heart disease often carry heavy emotional burdens, feelings they may not easily express. Persistent anxiety and hypervigilance. Even when cardiac test results come back normal or the condition appears stable, many individuals remain gripped by unease. They may become overly sensitive to the slightest bodily changes, fearing that a fleeting chest pain or a sudden heartbeat spike signals something serious. B. Overcoming the barrier of public misunderstanding. A lack of understanding or misconceptions about heart disease from those around the patient can unintentionally add stress and hardship. Loved ones who don't accept or understand the condition. This can lead to a lack of necessary support for treatment compliance or lifestyle changes, e.g. difficulty adjusting the family diet, or even blame for making too big a deal out of it. Difficulty explaining the condition to family members. Trying to communicate complex medical concepts, explain the need for interventions like stents or lifelong medication, or describe day-to-day limitations can be challenging and sometimes lead to misunderstandings and unnecessary conflict. equipping yourself with skills and actions to protect yourself, and learn CPR and how to use an automated external defibrillator. This growing need stems from the desire to act quickly and effectively during a life-threatening emergency. Be proactive about cardiovascular screening. Moving away from a mindset of complacency, more people are seeking regular heart checkups, even from a young age, as early as 30, to detect hidden risk factors early. Seek and stick with long-term treatment plans. This includes understanding the role of cardiac support devices like coronary stents, pacemakers, and implantable defibrillators, ICDs, recognizing the importance of taking medications consistently, and making sustainable lifestyle changes under the guidance of a cardiologist. Understanding the difference between heart attack, cardiac arrest, and heart failure is just the beginning. Taking action is the key. Don't wait. Start protecting your heart health today with a heart-friendly lifestyle. Eat wisely, exercise regularly, avoid tobacco, and manage stress. Listen to your body, get regular checkups, and share this knowledge. To prevent heart attack and other heart diseases, turn every daily choice into a step toward heart protection. Your health is priceless. Act now.